Question 1. Which of the following statements about motivational interviewing is true? A. My focus is on uncovering the unconscious mind to uncover the root causes of substance use. B. My is a directive, client-centered counseling approach aimed at enhancing motivation to change by exploring and resolving the ambivalence. C. My encourages clients to confront the consequences of their substance use aggressively in the early stages of treatment. D. My is best suited for clients who are already in the action stage of change and have ambivalence about stopping substance use. Answer. B. My is a directive, client-centered counseling approach aimed at enhancing motivation to change by exploring and resolving ambivalence. Explanation. Motivational interviewing is a client-centered directive counseling style designed to enhance a client's motivation to change by exploring and resolving ambivalence toward change. The approach is non-confrontational and collaborative, aiming to strengthen the client's own motivation. Commitment to change, particularly for those who are in the early stages of change. My focus is on empathetic listening, developing discrepancies between the client's current behavior and their values, and eliciting self-motivational statements. It does not focus on uncovering unconscious causes. A. Nor does it encourage aggressive confrontation. C. It is most effective in the early stages, pre-contemplation and contemplation, not when clients already fully committed. D. Question 2. A counselor is working with a client who has been diagnosed with both alcohol dependence and major depressive disorder, MDD. The client has started medication for both conditions but is experiencing difficulty in adhering to the treatment plan. Which of the following approaches should the counselor take to best address this situation? A. Focus on resolving the substance use disorder first and delay addressing the depressive symptoms until the alcohol use is under control. B. Use a strictly behaviorally focused treatment plan, neglecting to address any psychological issues like depression that are not immediately causing harm. C. Utilize an integrated treatment approach that addresses both the alcohol use disorder and the depression simultaneously, recognizing their interrelated nature. D. Suggest that the client discontinue medications for MDD as it may interfere with the effectiveness of alcohol treatment. Answer. C. Utilize an integrated treatment approach that addresses both the alcohol use disorder and the depression simultaneously, recognizing their interrelated nature. Explanation. An integrated treatment approach is the most effective way to address co-occurring disorders such as substance use disorder, SUD, and major depressive disorder, MDD. Research has shown that treating both conditions simultaneously leads to better outcomes as the disorders are often interrelated and can exacerbate each other. Delaying the treatment of depression may worsen the client's overall condition. Strictly behavioral approach B is inadequate when dealing with co-occurring disorders as it ignores the psychological factors that may be contributing to substance use. Discontinuing medications for depression D could have serious consequences, and it is important to monitor and manage both conditions concurrently under the guidance of the client's healthcare providers. Question 3. Scenario-based question. Mr. Thomas, a 32-year-old male, has been in treatment for alcohol dependence for 3 months. He has been attending group therapy regularly and has made significant progress, but he confides in his counselor that he is starting to feel overwhelmed by stress at work and is considering drinking again to cope. What should the counselor's immediate response be in this situation? A. The counselor should immediately tell Mr. Thomas that drinking again would jeopardize his progress and suggest he leave the group therapy. B. The counselor should validate Mr. Thomas' feelings of stress, help him explore the reasons behind the urge to drink, and work on developing healthy coping strategies. C. The counselor should encourage Mr. Thomas to avoid discussing his stress with others and keep his feelings to himself to prevent relapse. D. The should contact Mr. Thomas' employer to inform them of the situation and suggest possible adjustments at work. Answer. B. The counselor should validate Mr. Thomas' feelings of stress, help him explore the reasons behind the urge to drink, and work on developing healthy coping strategies. Explanation. In this situation, the counselor's role is to empathize with Mr. Thomas' stress and acknowledge his concerns, as stress is a common trigger for relapse in clients with alcohol dependence. The counselor should use motivational interviewing techniques to explore why Mr. is considering drinking again, helping him understand the underlying emotions or situations that are contributing to this thought. Developing healthy coping strategies, such as relaxation techniques, stress management, and problem-solving skills, can empower Mr. Thomas to handle stress without turning to alcohol, immediately dismissing the issue or suggesting secrecy. C. Would not address the underlying causes of the urge to drink. Contacting the employer is an inappropriate response unless there are concerns for immediate safety or duty to report, and it may violate confidentiality. Question 4. A counselor is working with a client who has struggled with opioid use disorder for the past 10 years. The client has recently entered a medication-assisted treatment MAT program using buprenorphine. Despite the treatment, the client has expressed concerns about the long-term use of medication and feels that they should eventually stop taking the medication. How should the counselor address the client's concerns regarding long-term MAT use? A. The counselor should strongly recommend that the client taper off the medication as soon as possible to demonstrate progress in treatment. B. The counselor should validate the client's concerns, provide education about MAT, discuss the benefits of MAT in maintaining recovery, and involve the client in discussion about their long-term treatment goals. C. The counselor should suggest that the client stop the medication immediately and rely solely on behavior therapy to achieve abstinence. D. The counselor should ignore the client's concerns, focusing only on the addiction recovery process and not on the medication itself. Answer. B. The counselor should validate the client's concerns, provide education about MAT, discuss the benefits of MAT in maintaining recovery, and involve the client in discussion about their long-term treatment goals. Explanation. In the context of opioid use disorder, MAT with buprenorphine is an evidence-based treatment that can help maintain recovery by preventing withdrawal symptoms and reducing cravings. Counselors should address the client's concerns, acknowledging the importance of the client's autonomy and personal goals for treatment, providing education about MAT's benefits, such as supporting long-term recovery and reducing the risk of relapse, is crucial. Engaging the client in discussion about their long-term goals ensures that the treatment plan aligns with their needs. Recommending an immediate cessation of medication, C, or ignoring concerns, D, would be counterproductive and could endanger client's recovery. Hasty taper, A, without careful, collaborative discussion can result in relapse or harm. Question 5. Which of the following is the most effective method to engage a client in the contemplation stage of change in the trans-theoretical model, TTM? A. Encouraging the client to immediately quit their substance use and face the consequences of their actions. B. Helping the client explore the pros and cons of their substance use and the potential benefits of changing without pressuring them for an immediate commitment. C. Confronting the client with evidence of their substance-related problems, pushing them to admit they have a problem. D. Suggesting that the client wait until they are ready to change on other life aspects until they decide. Answer. B. Helping the client explore the pros and cons of their substance use and the potential benefits of changing without pressuring them for an immediate commitment. Explanation. In the contemplation stage of change, the client is aware that they have a problem but has not yet committed to change. The most effective method at this stage is to engage the client in exploring the pros and cons of their substance use and the benefits of making a change. The approach builds motivation without pressure, using a non-judgmental, empathetic stance that respects the client's autonomy. Pressuring the client to quit immediately, A, or confronting them too aggressively, C, may increase resistance. Suggesting that the client wait until they are ready, D, does not support the necessary reflection and engagement in the process of change at this stage. Question 6. Mr. Jackson, a 40-year-old male, has been in outpatient treatment for alcohol use disorder for several months. He has relapsed twice, but each time he has learned something new about his triggers and coping mechanisms. In his most recent session, Mr. Jackson describes a stressful encounter at work that nearly caused him to relapse again. What would be the most appropriate intervention for the counselor to take in this situation? A. Tell Mr. Jackson that relapse is part of the recovery process and that he should continue to attend meetings but avoid discussing the relapse further. B. Help Mr. Jackson identify the specific triggers that led to the relapse risk, explore alternative coping strategies, and reinforce the importance of using these strategies in future stressful situations. C. Recommend that Mr. Jackson increases alcohol consumption in controlled amounts to reduce cravings in a safe environment. D. Suggest that Mr. Jackson take a break from treatment to focus on work-related stress and return once he feels more in control. Answer. B. Help Mr. Jackson identify the specific triggers that led to the relapse risk, explore alternative coping strategies, and reinforce the importance of using these strategies in future stressful situations. Explanation. Relapse is often a part of the recovery journey, and understanding the specific triggers that led to relapse is a critical step in preventing future relapses. In this case, the counselor should help Mr. Jackson explore the work situation and identify what about the encounter triggered his cravings. This will allow the counselor to guide him in developing alternative coping mechanisms to use when faced with similar situations in the future. Focusing on the lesson learned from the relapse, B, supports the recovery process while minimizing or ignoring the relapse, A, misses an important opportunity for learning. Encouraging increased alcohol use, C, would be dangerous and to the goals of treatment, suggesting a break from treatment, D, would leave the client vulnerable and not address the root causes of the stress. Question 7. A client diagnosed with cocaine use disorder has been participating in a 12-step program for several months and reports feeling significant relief from cravings and urges to use cocaine. However, the client continues to struggle with relationships, especially with family members who are not supportive of their recovery. What should the counselor focus on in this case to help the client manage these interpersonal challenges? A. Encourage the client to focus only on their recovery and ignore the negative family relationships until they are stronger in sobriety. B. Advise the client to distance themselves from their family members to avoid the emotional stress caused by their lack of support. C. Work with the client to identify the impact of family dynamics on their recovery, explore strategies for improving communication and boundaries, and provide psychoeducation about family involvement in recovery. D. Suggest that the client end all contact with family members who do not support their recovery, as it will ultimately help the client stay sober. Answer. C. Work with the client to identify the impact of family dynamics on their recovery, explore strategies for improving communication and boundaries, and provide psychoeducation about family involvement in recovery. Explanation. While maintaining sobriety is paramount, managing interpersonal relationships, especially with family members, is a crucial part of long-term recovery. Family dynamics can significantly impact the recovery, and it is essential for the counselor to work with the client to explore these dynamics and the impact they have on their recovery. Teaching communication skills and helping the client set healthy boundaries can strengthen their relationships and provide emotional support. Simply advising the client to ignore their family, A, or cut ties, D, could isolate the client and reduce potential support. Distancing from family members, B, does not address the core issues and exacerbate the client's emotional stress. Question 8. What is the primary focus of crisis intervention in addiction treatment, particularly when working with a client in the acute phase of substance use? A. To confront the client about their substance use behaviors and set strict boundaries for treatment. B. To provide immediate emotional support, stabilize the client, assess the severity of the crisis, and then begin planning for ongoing care. C. To explore the root causes of the client's substance use with focus on long-term recovery strategies. D. To immediately refer the client to residential treatment without first assessing the immediate need. Answer. B. To provide immediate emotional support, stabilize the client, assess the severity of the crisis, and then begin planning for ongoing care. Explanation. Crisis intervention in addiction treatment is aimed at providing immediate support during acute situations, such as when a client is experiencing high emotional distress or is in danger of self-harm. The goal is to stabilize the client and assess the severity of the crisis, followed by planning ongoing care, which may include referrals to appropriate treatment programs or additional support services. Confrontation, A, or focusing solely on long-term strategies. C, would not address the urgent needs of the client in crisis. Immediate referral to residential treatment. D, may not be necessary or appropriate without first assessing the client's immediate crisis and needs. Question 9. A 35-year-old female client with a history of alcohol use disorder is attending weekly therapy sessions. During a session, she reveals that she is feeling increasingly isolated because her close friends have distanced themselves due to her previous drinking behavior. How should the therapist approach this situation to help the client address the social aspects of her recovery? A. Encourage the client to immediately cut ties with her former friends to prevent relapse triggers. B. Validate the client's feelings of loneliness, explore the impact of her social circle on her recovery, and work together to develop strategies for building new supportive relationships. C. Advise the client to avoid discussing her recovery with her friends to prevent uncomfortable conversations. D. Suggest that the client attend therapy less frequently, should focus more on socializing with supportive individuals outside of treatment. Answer. B. Validate the client's feelings of loneliness, explore the impact of her social circle on her recovery, and work together to develop strategies for building new supportive relationships. Explanation. Social support is a critical factor in recovery from addiction. By validating the client's feelings and exploring how her social circle affects her recovery, the therapist can help the client understand the importance of surrounding herself with support. Individuals developing new, healthy relationships that reinforce recovery goals can reduce feelings of isolation and promote long-term sobriety. Advising the client to cut ties with friends they might not address the underlying issues and avoiding conversations about recovery at sea can hinder the client's progress. Reducing therapy frequency may leave the client without enough support during crucial time. Question 10. A client in outpatient treatment for opiate use disorder has been participating in a harm reduction program and is gradually reducing their drug use. They express frustration about their progress, stating that they feel stuck and are not making the rapid improvements they had hoped for. What would be the most appropriate response for the counselor to provide in this situation? A. Reassure the client that quick progress is not always possible and advise them to focus solely on their physical health and ignore emotional concerns. B. Validate the client's feelings of frustration, normalize the slow process of recovery, and help them set realistic incremental goals to track their progress. C. Urge the client to push harder in their efforts to reduce drug use and commit to a faster pace of change. D. Suggest the client increase their drug use slightly to manage their emotional distress and come back when they feel more prepared for recovery. Answer. B. Validate the client's feelings of frustration, normalize the slow process of recovery, and help them set realistic incremental goals to track their progress. Explanation. Recovery from substance use disorders, particularly with opioids, can be a slow and difficult process. Validating the client's frustration and normalizing the fact that recovery does not always happen quickly can help reduce feelings of discouragement. Setting achievable goals allows the client to see their progress and stay motivated. Urging the client to push harder, C, can be counterproductive and may increase pressure, suggesting a return to drug use. D, would jeopardize the client's recovery, and focusing only on physical health, they neglects the emotional aspects of recovery. Question 11. A client recently diagnosed with a dual diagnosis of alcohol use disorder and major depressive disorder has been resistant to participating in individual therapy. They report feeling hopeless and overwhelmed by their mental health symptoms and addiction. What is the most appropriate first step the therapist should take to address the client's needs? A. Immediately introduce cognitive behavioral therapy (CBT) to address both the addiction and the depression, assuming it will be most effective. B. Acknowledge the client's feelings of hopelessness, build rapport, and explore their readiness to engage in treatment for both their depression and addiction. C. Recommend medication for both conditions without discussing therapy options. D. Focus exclusively on treating the alcohol use disorder first, as it should take priority over mental health concerns. Answer. B. Acknowledge the client's feelings of hopelessness, build rapport, and explore their readiness to engage in treatment for both their depression and addiction. Explanation. Dual diagnosis cases require a comprehensive approach that addresses both the addiction and the co-occurring mental health disorder. The first step is to build rapport and acknowledge the client's emotional state, which helps in establishing trust. Exploring the client's readiness to engage in treatment is essential before moving forward with any therapeutic approach. Focusing solely on one issue, D, or pushing for immediate intervention, A, may not be effective if the client is not ready or able to engage. Introducing medication without addressing the client's feelings and readiness, C, overlooks the need for holistic and collaborative approach. Question 12. A 45-year-old male client in early recovery from cocaine use disorder is expressing concern about his inability to control his spending habits. He has recently spent a large sum of money on items he doesn't need, and he feels guilt about it. How should the counselor address this issue in the context of his recovery? A. Suggests that the client immediately return all of the items purchased and focus on managing finances in isolation from recovery. B. Explore the underlying causes of the client's compulsive spending behavior, which may be connected to emotional dysregulation or avoidance behaviors, and provide strategies for improving financial responsibility. C. Recommend that the client avoid discussing finances altogether in therapy and focus solely addiction-related issues. D. Encourage the client to withdraw from all social interactions until they have learned to manage their spending. Answer. B. Explore the underlying causes of the client's compulsive spending behavior, which may be connected to emotional dysregulation or avoidance behaviors, and provide strategies for improving financial responsibility. Explanation. In early recovery, clients often experience difficulty managing impulse control, which can manifest in behaviors like compulsive spending. It's important to explore the psychological and emotional factors drive client spending, as this may be related to deeper issues such as emotional regulation or avoidance of uncomfortable feelings. Helping the client develop strategies to manage finances and make more responsible decisions is key part of recovery. Focusing only on financial isolation, C, or encouraging withdrawal from social situations, D, would not help address the underlying behaviors. Returning the items is not sustainable solution without addressing the root causes. Question 13. A client with a history of methamphetamine use disorder has recently relapsed after 6 months of sobriety. The client is experiencing intense shame and guilt about the relapse and feels they are incapable of achieving long-term recovery. How should the counselor approach this situation? A. Reassure the client that relapse is part of the process and minimize the emotional impact by focusing only on their physical recovery. B. Explore the emotions of shame and guilt with the client, helping them reframe their thoughts around the relapses, a learning experience and an opportunity for growth. C. Advise the client to discontinue therapy until they are ready to accept that relapse is inevitable and uncontrollable. D. Dismiss the client's feelings, suggest that they return to their previous treatment plan without exploring the underlying causes of relapse. Answer. B. Explore the emotions of shame and guilt with the client, helping them reframe their thoughts around the relapses, a learning experience and an opportunity for growth. Explanation. Relapse can be a normal part of recovery, but how a client responds to it is crucial. By acknowledging and exploring the emotions of shame and guilt, the counselor can help the client reframe their experience. This approach supports a growth mindset and reduces the risk client feeling hopeless about recovery, minimizing the emotional impact or dismissing the relapse without exploring its causes. D. Would hinder progress. Advising the client to discontinue therapy. C. Could isolate them and make recovery more difficult. Question 14. A client in treatment for opioid use disorder reports that they are struggling with ongoing cravings, especially in situations where they are triggered by environmental cues. What would be the most effective intervention for the counselor to use in addressing the client's cravings? A. Recommend that the client remove themselves from all environmental triggers immediately and avoid any situation where they might experience cravings. B. Teach the client coping strategies such as mindfulness, relaxation techniques, and cognitive restructuring to manage cravings when they arise and encourage the development of healthy routines. C. Advise the client to ignore cravings and continue their daily routine without focusing on them, as they eventually dissipate on their own. D. Focus exclusively on increasing the client's medication dosage to prevent cravings from occurring in the future. Answer. B. Teach the client coping strategies such as mindfulness, relaxation techniques, and cognitive restructuring to manage cravings when they arise and encourage the development of healthy routines. Explanation. Cravings are a common challenge in opioid recovery, but they can be managed with appropriate coping strategies. Teaching mindfulness, relaxation techniques, and cognitive restructuring helps the client reframe their thoughts and develop healthier to cope with cravings. Encouraging healthy routines provides structure and reduces the likelihood of encountering high-risk situations. Simply removing triggers or ignoring cravings C does not address the underlying issue. Focusing solely on increasing medication dosage D without addressing behavioral and emotional aspects may not provide long-term relief. Question 15. A client in long-term recovery from alcohol use disorder is starting to experience increasing stress due to work demands and relationship problems. The client reports feeling overwhelmed and concerned about how the stress could lead to a relapse. How should the counselor support the client in managing this stress? A. Encourage the client to take a break from therapy until the stress resolves and they feel more in control. B. Help the client identify and practice stress management techniques, including problem-solving skills, self-care strategies, and support from their recovery network. C. Suggest that the client reduce their work hours and take time off from responsibilities to decrease stress levels. D. Reassure the client that stress is inevitable. Encourage them to handle it on their own without relying on outside help. Answer. B. Help the client identify and practice stress management techniques, including problem-solving skills, self-care strategies, and support from their recovery network. Explanation. Managing stress is crucial for maintaining long-term sobriety, and learning effective stress management techniques can empower the client to handle future challenges. Problem-solving skills, self-care strategies, and support from their recovery network can provide the client with tools they need to cope with stress without resorting to substances. Taking a break from therapy A or work C might not be sustainable as it avoids addressing the underlying stress. Encouraging the client to handle stress alone D undermines the support systems that are critical to recovery. Question 16. A 30-year-old male client in recovery from heroin addiction is expressing frustration during therapy. He admits to feeling out of place when he attends 12-step meetings and describes a lack of connection with the other participants. What should be the counselor's primary focus in this situation? It suggests that the client discontinue attending 12-step meetings since they are not benefiting from the experience. B. Validate the client's feelings of isolation and explore their concerns about connecting with others, helping them find alternative support systems or activities that could foster meaningful connections. C. Advise the client to give the meetings more time and encourage them to attend even more frequently to overcome their feelings. D. On the client's substance use and suggest that they stop attending therapy in order to focus exclusively on recovery. Answer. B. Validate the client's feelings of isolation and explore their concerns about connecting with others, helping them find alternative support systems or activities that could foster meaningful connections. Explanation. Social support is critical in recovery, and if the client feels isolated or disconnected in group settings, their concerns should be explored. The therapist can help the client understand that building connections takes time and might involve trying different forms of support. Focusing solely on substance use. D. Ignores the emotional and social factors contributing to the client's feelings. Encouraging more frequent meetings. C. Without addressing the client's concerns is unlikely to be effective. Suggesting they stop attending 12-step meetings entirely. A. Could undermine their recovery process. Question 17. A 42-year-old female client recovering from alcohol use disorder reveals in a session that she has started engaging in binge eating behaviors since coming sober. She expresses guilt and shame about this new behavior. Weighs the best course of action for the counselor to take. A. Encourage the client to avoid discussing the eating behavior and focus only on alcohol use. B. Acknowledge the client's feelings of guilt and shame and explore the underlying emotions contributing to the binge eating, helping the client address both behaviors simultaneously. C. Recommend that the client seek separate treatment for eating disorders and focus solely on maintaining sobriety in therapy. D. Suggests that the client indulge in eating in moderation to prevent feelings of restriction and deprivation. Answer. B. Acknowledge the client's feelings of guilt and shame and explore the underlying emotions contributing to the binge eating, helping the client address both behaviors simultaneously. Explanation. Addressing both substance use and other behavioral health issues such as binge eating is important, as they may be linked to emotional regulation or coping mechanisms. The counselor should validate the client's emotions and explore the connection between the behaviors. Focusing exclusively on alcohol use. A. Ignores the new issue and recommending separate treatment. C. Might delay addressing both concerns in timely manner. Suggesting indulgence in binge eating. D. Would reinforce unhealthy coping strategies. Question 18. A 25-year-old male client with a history of depression and cannabis use disorder is discussing his current mental health challenges in therapy. He states that he feels his depression is improving, but he continues to use cannabis to help manage his anxiety. How should the counselor address this situation? They suggest that the client continue using cannabis as the coping strategy until they feel ready to fully stop, as long as it is not causing major problems. B. Encourage the client to stop using cannabis immediately and focus exclusively on improving their mental health through therapy and other interventions. C. Explore the role of cannabis in the client's mental health management. Educate them about the potential negative effects of using substances for self-medication and collaboratively develop alternative coping strategies for anxiety. D. Reassure the client that using cannabis occasionally is acceptable and advise them to continue with their current routine of use and therapy. Answer. C. Explore the role of cannabis in the client's mental health management. Educate them about the potential negative effects of using substances for self-medication and collaboratively develop alternative coping strategies for anxiety. Explanation. While the client may find temporary relief from anxiety through cannabis use, it is important to help them understand the potential long-term effects and the risks of relying on substances to mental health. exploring the role of cannabis in their coping strategies and helping them develop healthier alternatives can support long-term recovery and mental well-being, suggesting that the client continue using cannabis A or accept occasional use. D overlooks the need for healthier coping mechanisms, recommending an immediate cessation. B may not be realistic without addressing the root cause of the client's anxiety. Question 19. A 60-year-old client with a history of opioid use disorder is in recovery and has been working on re-establishing relationships with family members. However, the client is struggling to reconnect with a sibling who has expressed anger about the client's past drug use. What would be the best way for the counselor to help the client navigate this relationship issue? A. Encourage the client to cut ties with the sibling to avoid further emotional distress. B. Suggest that the client continue attempting to reconnect with the sibling while also setting boundaries to protect their emotional well-being. C. Advise the client to avoid contacting the sibling and focus solely on their recovery and relationships with other family members. D. Recommend that the client try to convince the sibling to forgive them, even if they are not yet. Answer. B. Suggest that the client continue attempting to reconnect with the sibling while also setting boundaries to protect their emotional well-being. Explanation. Rebuilding relationships, particularly with family members, can be a challenging part of recovery. The counselor can guide the client in maintaining open communication with the sibling while also setting healthy boundaries to manage emotional stress, avoiding the sibling C or cutting ties entirely. A. Not resolve the underlying conflict. Forcing reconciliation or forgiveness D without the sibling's readiness could increase tension. Question 20. A 40-year-old client in therapy for post-traumatic stress disorder (PSD) related to childhood abuse discloses that they have recently been experiencing vivid flashbacks and nightmares. The client is also hesitant to engage in trauma-focused therapy due to fear of re-traumatization. What should the counselor's approach be in addressing these concerns? A. Encourage the client to confront the traumatic memories immediately, as this is the fastest way to resolve their ESD symptoms. B. Reassure the client that flashbacks and nightmares are common in ESD and work together to develop coping strategies before introducing trauma-focused therapy. C. Suggest that the client stop discussing the trauma to avoid re-triggering painful memories and focus on other aspects of their life. D. Recommend that the client immediately begin medication for PSD to manage the symptoms without addressing the trauma in therapy. Answer. B. Reassure the client that flashbacks and nightmares are common in ESD and work together to develop coping strategies before introducing trauma-focused therapy. Explanation. Trauma-focused therapy can be difficult for clients with PSD, and it's important to proceed at the client's pace. Reassuring the client that flashbacks and nightmares are common can help normalize their experience and reduce feelings of shame or fear. Working together to develop coping strategies gives the client tools to manage symptoms before engaging in more intense trauma-focused work. Forcing immediate confrontation could exacerbate the trauma. Avoiding the trauma entirely. C. Might delay the healing process, and medication D alone does not address the emotional and psychological aspects of EEC. Question 21. A 32-year-old female client in early recovery from a prescription painkiller addiction expresses concerns about her ability to manage stress without resorting to medication. She reports that stress is a major trigger for her cravings. How should the counselor best support the client in this situation? It suggests that the client take a break from therapy to focus on managing stress independently. B. Help the client identify specific stressors. Develop healthy coping strategies such as relaxation techniques or physical activity, and build a support network to help manage stress. C. Encourage the client to avoid discussing stress entirely and focus on other aspects of their recovery. D. Recommend that the client increase their medication dosage, manage stress more effectively. Answer. B. Help the client identify specific stressors, develop healthy coping strategies such as relaxation techniques or physical activity, and build a support network to help manage stress. Explanation. Stress is a significant trigger for relapse in early recovery, and it's essential to develop healthy coping strategies to manage it. The counselor should work with the client to identify stressors and create a plan that includes relaxation techniques, activity, and social support. Ignoring stress. C. Or focusing only on medication management. D. Would not address the client's need for effective, long-term coping strategies. Taking break from therapy. A. Might isolate the client and leave them without necessary support. Question 22. A 28-year-old male client in recovery from methamphetamine addiction is seeking advice on how to maintain sobriety while working in an environment that he perceives as triggering. His workplace involves high-pressure sales and frequent contact with individuals who use substances. How should the counselor approach this issue? I advise the client to leave their job immediately to avoid exposure to triggering situations. B. Help the client explore their feelings about the job, discuss strategies for managing triggers, and potentially develop a plan for seeking a different role if necessary. C. Suggest that the client confront their coworkers about their substance use and try to convince them to stop. D. Reassure the client that the job itself is not an issue and encourage to focus only on their recovery. Answer. B. Help the client explore their feelings about the job, discuss strategies for managing triggers, and potentially develop a plan for seeking a different role if necessary. Explanation. The counselor should help the client explore their feelings about their work environment and identify specific triggers that may increase the risk of relapse, developing coping strategies and potentially considering a job change if necessary. Empowers the client to make decisions that prioritize their recovery, suggesting immediate job termination may not be a realistic or sustainable solution. Confronting coworkers. C. Could create unnecessary conflict and focusing solely on recovery without addressing the work environment. D. Does not address the reality of the client's situation. Question 23. A 50-year-old client with a history of alcohol use disorder is struggling with anxiety and insomnia, both of which have persisted since they stopped drinking. The client reports a high level of distress due to their sleep problems, which seem to be worsening over time. What is the most appropriate response for the counselor? A. Suggests that the client take sleep medications to alleviate the insomnia and focus on their recovery without addressing the underlying anxiety. B. Reassure the client that insomnia is common after stopping alcohol use and recommend they wait for the symptoms to subside on their own. C. Explore the connection between the client's anxiety and sleep difficulties, helping them develop relaxation techniques, sleep hygiene practices, and other strategies to manage both issues. D. Advise the client to return to alcohol use in moderation to address the insomnia and reduce anxiety. Correct answer. C. Explore the connection between the client's anxiety and sleep difficulties, helping them develop relaxation techniques, sleep hygiene practices, and other strategies to manage both issues. Explanation. Anxiety and insomnia can be common after alcohol cessation, and it's important to address both symptoms through a holistic approach. Exploring the connection between the two can help the client understand their underlying stressors. Relaxation techniques and good sleep hygiene can provide effective strategies for managing these issues without resorting to medication or alcohol. D. Reassurance without intervention. B. May leave the client struggling unnecessarily. Question 24. A client recovering from a gambling addiction reveals that they have started spending more time on online shopping websites, and they worry it is becoming another compulsive behavior. How should the counselor respond to this new concern? A. Ignore the concern as it is not directly related to gambling recovery. B. Explore the client's emotional state and the possible connection between online shopping and the gambling behavior and discuss strategies to manage compulsive behaviors. C. Recommend that the client completely avoid any form of shopping and focus solely on recovery from gambling addiction. D. Encourage the client to indulge in online shopping in moderation as it can serve as a healthy substitute for gambling. Answer. B. Explore the client's emotional state and the possible connection between online shopping and the gambling behavior and discuss strategies to manage compulsive behaviors. Explanation. Compulsive behaviors can often transfer from one activity to another, especially in early recovery. By exploring the emotional connection to the new behavior, the counselor can help the client understand the underlying issues and develop strategies to manage these behaviors. Avoiding all forms of shopping, C, or indulging in the behavior in moderation, D, does not address the root cause. Ignoring the concern, A, can allow the issue to escalate. Question 25. A 60-year-old male client recovering from alcohol use disorder expresses concerns about his relationship with his spouse, who continues to drink socially. The client feels conflicted about attending social events where alcohol is present. How should the counselor address the client's concerns? They advise the client to avoid all social events where alcohol is present to prevent relapse triggers. B. Suggest that the client ask their spouse to stop drinking socially to support their recovery. C. Explore the client's feelings about attending social events and develop strategies for managing triggers, such as setting boundaries and identifying sober activities to engage in during these events. D. Reassure the client that their spouse's drinking is a problem and they should continue to attend social events as they normally would. Answer: C. Explore the client's feelings about attending social events and develop strategies for managing triggers, such as setting boundaries and identifying sober activities to engage in during these events. Explanation: social events with alcohol can be triggering for someone in recovery, and it is important to help the client navigate these situations. Exploring the client's feelings and developing strategies such as setting boundaries or ways to enjoy events without feeling pressured to drink empowers the client to stay sober while maintaining relationships. Advising complete avoidance might limit the client's ability to engage in social life, while asking the spouse to change their behavior. B. May not be realistic. Reassuring the client without addressing the issue. D. Could lead to unnecessary risk of relapse. Question 26. A 38-year-old female client in therapy for opioid use disorder has been sober for 6 months. She reports experiencing intense cravings during stressful situations, especially when facing family conflicts. How should the counselor address the client's cravings? A. Advise the client to ignore the cravings and focus only on managing family conflicts. B. Validate the client's feelings, explore the relationship between stress and cravings, and introduce coping mechanisms such as mindfulness or deep breathing exercises to manage these cravings. C. Suggest that the client return to opioid use in moderation to relieve stress. D. Recommend that the client avoid family interactions to prevent further and cravings. Answer: B. Validate the client's feelings, explore the relationship between stress and cravings, and introduce coping mechanisms such as mindfulness or deep breathing exercises to manage these cravings. Explanation: cravings are a common challenge in recovery, especially in response to stress. Validating the client's feelings and addressing the connection between stress and cravings is crucial. Offering coping mechanisms such as mindfulness and relaxation techniques can help the client manage cravings without resorting to substance use. Ignoring the cravings or recommending relapse C. would not address the root of the problem. Avoiding family interactions D. may not be sustainable and can isolate the client from important relationships. Question 27. A 45-year-old male client recovering from cocaine addiction shares that he is starting to experience feelings of anger and frustration during therapy sessions. He attributes these emotions to a lack of progress in rebuilding his career and finances since getting sober. How should the counselor respond to the client's concerns? It suggests that the client focus solely on their recovery and not worry about career or financial issues at this stage. B. Validate the client's feelings of frustration and explore how these emotions are impacting their recovery while working together to identify practical steps for rebuilding their career and finances. C. Advise the client to stop focusing on their career and finances altogether to avoid further stress. D. Reassure the client that career and finances will automatically improve as they continue their recovery without needing to focus on these issues. Answer: B. Validate the client's feelings of frustration and explore how these emotions are impacting their recovery while working together to identify practical steps for rebuilding their career and finances. Explanation: frustration with life circumstances, such as career or financial struggles, can significantly impact recovery. By validating these feelings and exploring how they affect the client's sobriety, the counselor can help the client develop practical solutions for rebuilding their life. Suggesting that the client focus only on recovery without addressing real-life concerns may not be helpful. Completely avoiding career and financial issues C. may leave the client feeling unfulfilled and unresolved. Reassuring the client without offering action steps D. may not effectively support their recovery process. Question 28. A 32-year-old female client in recovery from alcohol use disorder expresses that she feels disconnected from her friends who still drink regularly. She is hesitant to attend social gatherings because of the temptation to drink. What should the counselor's primary focus be in this situation? A. Encourage the client to avoid social gatherings entirely to prevent relapse. B. Discuss the client's feelings of disconnection and explore how they can stay true to their recovery goals while also managing relationships with friends who still drink. C. Recommend that the client confront her friends and ask them to stop drinking in her presence. D. Advise the client to gradually return to social gatherings even if they are tempted to drink in or strengthen their resolve. Answer: B. Discuss the client's feelings of disconnection and explore how they can stay true to their recovery goals while also managing relationships with friends who still drink. Explanation: the counselor should explore the client's feelings of isolation and help them find ways to maintain relationships while prioritizing their recovery. This might include setting boundaries, such as attending events without drinking or finding alternative social activities. Avoiding social gatherings entirely. A. Might isolate the client. Confronting friends. C. May not be helpful or realistic, and advising gradual exposure without proper coping strategies. D. Could lead to relapse. Question 29. A 60-year-old client recovering from alcohol use disorder confesses that they sometimes feel bored or empty after work and have a strong urge to drink in order to fill the void. How should the counselor address these feelings of boredom or emptiness? A. Recommend that the client immediately fill their time with new hobbies or activities without addressing the underlying feelings. B. Explore the underlying causes of the boredom or emptiness, such as unmet emotional needs, and work with the client to identify fulfilling activities or relationships that can provide meaning. C. Suggest that the client return to drinking in moderation to manage their feelings of boredom. D. Advise the client to isolate themselves from social interactions to avoid the temptation of drinking. Answer: B. Explore the underlying causes of the boredom or emptiness, such as unmet emotional needs, and work with the client to identify fulfilling activities or relationships that can provide meaning. Explanation: feelings of boredom or emptiness are common in recovery, especially if the client used substances to cope with emotions. The counselor should explore these feelings and help the client identify meaningful activities or connections to address their needs. Simply filling time with new hobbies without addressing the root causes may not be enough. Returning to drinking, C, or isolating, D, would not resolve the emotional void and could jeopardize the recovery process. Question 30. A 28-year-old male client recovering from methamphetamine addiction reveals that he is feeling a sense of loss after quitting meth, as it was once a major part of his identity. How should the counselor approach this issue? A. Encourage the client to repress any feelings of loss and focus only on the positive aspects of recovery. B. Explore the client's sense of identity and how meth use was tied to their self-concept, helping them rebuild new, healthier sense of self in recovery. C. Suggest that the client use other substances to fill the void left by methamphetamine. D. Recommend that the client avoid reflecting on their past addiction, as it might hinder their recovery. Answer: B. Explore the client's sense of identity and how meth use was tied to their self-concept, helping them rebuild new, healthier sense of self in recovery. Explanation: addiction often becomes intertwined with an individual's identity, and recovery can create sense of loss or confusion. The counselor should help the client explore how meth use shaped their self-concept and guide them in developing new, positive identity in recovery. Repressing feeling or suggesting substance use, C, would only harm the client. Avoiding reflection, D, could prevent important healing and self-discovery.